Welcome back to Dog Hobby 2020. Please participate in the polls that appear on top right of your screen. For social message, please go to last 2.5 minutes of the video. Today's topic is sickle cell anemia. Before we go to the topic, let me remind you that medicines are not to be taken without doctor's prescription. Here we have a 6-year-old child from Nagpur who came to emergency with complaint of pain in the right knee. In India, Nagpur is one of the regions under sickle belt. Do you live in an area where sickle cell anemia is prevalent? If so, what is it? Comment below. Pain was spontaneous with no history of trauma. Doctor failed to calm child, but he managed to divert his attention to perform local examination. He noticed periarticular warmth and tenderness with no limitation of movement in right knee. Doctor started morphine sulfate IV bolus followed by infusion for pain management. Patient is afebrile with stable vitals and good oxygen saturation. As the drug is taking its effect, he confirmed that child is up to date with immunization and also that child complains of tiredness on playing games that involve running or jumping. Patient is calm now. On examination, child is icteric and pallor is present. Frontal and parietal bossing is noted. Teeth are mal-occluded. No organomegaly is detected. Bone scan showed abnormal uptake and bone marrow scan showed decreased activity, suggesting bone infarction. This also rules out acute osteomyelitis, which shows normal activity in bone marrow scan. Ultrasound detected splenomegaly. Hemoglobin and hematocrit are low. Leukocytosis is present but not considered as infection in this case unless it exceeds 20,000 per mm³ with left shift. Reticulocytosis is present. On contrary, if leukopenia and reticulocytopenia are present, suspect aplastic crisis due to parvovirus infection. If reticulocytes are greatly increased, suspect hemolytic crisis. If normal, suspect splenic sequestration. Platelet count is increased. If low, suspect hypersplenism. Peripheral smears show normocytes and sickle cells. If microcytes are seen, suspect compound heterozygous association with thalassemia. Havel-Zolli bodies are not there, suggesting spleen is still functional. Electrophoresis showed sickle hemoglobin 84% with no traces of hemoglobin A, confirming that child is suffering from sickle cell disease. Transcranial Doppler ultrasound detected normal cerebral flow velocity, assuring that there is no greater risk for stroke. Let us discuss our diagnosis, which is due to missense point mutation of beta-globin chain involving nucleotide-based thymine replace adenine, resulting in valine at 6th codon instead of glutamate, leading to formation of sickle hemoglobin, which polymerizes during hypoxia or on hemoconcentration. Sickling of RBC results in membrane damage and elongation over time, leaving behind characteristic sickle RBC. Sickle cells are sticky and adhere to endothelium along with other cells, causing stasis and occlusion, which manifests as pain crisis, also called vaso-occlusive crisis. Now let us see the treatment, which includes hydroxyurea. It increases fetal hemoglobin, which inhibits polymerization of sickle hemoglobin. It also decreases leukocytes with which sickle cells can interact. And finally, it increases nitric oxide, which causes vasodilation, decreasing stasis. Patient is given NSAID narcotic combination for chronic pain relief. Folic acid supplementation to prevent megaloblastic crisis. For folate-rich diet and megaloblastic crisis, please click the video pop-up appearing on top right corner. Glutamine to decrease episodes of vaso-occlusive crisis. Pneumococcal and meningococcal vaccines because patient can become asplenic over time due to splenic vessel occlusion by sickle cells, resulting in shrunken and non-functional spleen, which is termed autosplenectomy, rendering patient susceptible to infection by encapsulated organisms. Quality of healthcare can be improved in these patients if diagnosed prenatally or during newborn period, as sickling is a concern usually after 6 months because fetal hemoglobin starts declining from then. Prenatal diagnosis can be done by chorionic villus sampling at 8 to 12 weeks. Newborn can be screened through hemoglobin electrophoresis. Fetal hemoglobin with sickle hemoglobin with no traces of other hemoglobins implies sickle cell disease, in which child received mutated gene from both his parents. Or it can also be sickle cell beta 0 thalassemia. If hemoglobin A is detected and is less than sickle hemoglobin, then it is sickle cell beta plus thalassemia. If hemoglobin A is greater than sickle hemoglobin, it means sickle cell trait where only one parent carries sickle gene. If hemoglobin C is detected, it implies HBsC disease. Here, hemoglobin C is formed by missense point mutation replacing glutamate with lysine. Same goes for HBS-HBE syndrome with sickle hemoglobin and hemoglobin E. These associations of sickle hemoglobin with other hemoglobins is due to compound heterozygous inheritance where one parent contributes sickle hemoglobin gene and other for an abnormal hemoglobin gene like beta 0, beta plus, C, E, etc. In follow-up, tell parents about prenatal diagnosis and newborn screening if they are planning for another child. Tell them that hemoglobin S concentration in patients should be lowered below 30% to prevent recurrence, either by blood transfusion and iron chelation or erythrocytophoresis. Tell parents that erythrocytophoresis is economical in long term. Follow up after 2 weeks to assess any side effects of hydroxyurea like neutropenia and 6-monthly monitoring of reticulocyte count, transcutaneous oxygen saturation and annual monitoring of hemoglobin electrophoresis, annual eye checkup. Yearly screening tests include renal and liver function tests, transcranial ultrasound. Users of maintaining personal health records should be told, keeping child hydrated and avoiding extreme temperatures as dehydration and exposure to extreme environments can be triggered for sickling. Ask the parents to limit the child to exercises like brisk walking or jogging and not to overdo them. Tell them to stop child from doing strenuous exercises like running, swimming or sports involving these. Warning symptoms like pain in chest or abdomen, breathlessness, deviated or protruding eyeball, or vision impairment should be informed and asked to report immediately if they occur. Today's social message is about personal health record and it helps in giving the information to your doctor which you may not remember or understand. This will make your doctor understand your health status better and provide you better care. It will also avoid duplicate tests because your doctor may see some of your past records are reliable and may not write the same test. When you need to be treated in an emergency and is running out of time, your health record will give your doctor a basic idea on how to manage. Your record will help you understand how your health is over time and you may discuss on how to improve it further. You may consult doctors of various specialties and your health record will help them understand your past problem and current problem and their relation. You can assess yourself if your disease is worsening or not. You can check yourself if you are following the advice of doctor properly. Go to your health practitioner and retrieve your health records completing necessary formalities. Don't worry if you fail to procure your health data. From now, whenever you visit a doctor and come back, make your own health record. You can store hard copy in home and soft copy on your phone and computer home screens and make necessary editings. Here is a sample of health record and you can improvise it and suggest your ideas in comments or mail me through my email provided in description. Date of visit and age are components of timeline and you can pinpoint exact time of major health events like surgery, diagnosis of chronic health conditions like diabetes. Your weight and height will provide any significant gain or loss over time. Your diagnosis either confirmed or suspected. If many are suspected, then just write your symptoms and duration like cough since 5 weeks. Important findings in the report like high fasting glucose and its value, medicines advised and you can add duration. You can attach diet advice or any other advice like not to eat peanut etc. What diseases you have like hypertension, diabetes or asthma from how many years and what medicines you have been taking and advice applicable even now like reduced salt intake, major health events like appendix removal or tubectomy operation etc. I suggest you make a MS Word document and edit the details after every visit instead of piling up tons of sheets and store the reports, x-rays etc. Comment below, share to the relevant, like and subscribe for future videos. Thank you.